So I think considering treatment for substance use disorders on an individual basis is really important. There's not one approach that fits every patient. And really centering patients' goals and what their health goals specifically are as they relate to substance use is important to empowering people who have been previously stigmatized by their drug use. So, my first question always is what patients' journey with their history of drug use has been and what their goals are for this visit and every visit going forward, and hopefully empowering them to understand that they're really in the driver's seat in terms of which medications or which treatments or support they might choose. I think, one of the most important things for people to know about substance use disorders is that they're chronic diseases. And so being in a primary care clinic, being at somewhere like Hope's and receiving treatment for that is really important so that the community and patients themselves understand that these diseases have very effective treatments to help them reach what their goals are in terms of how they want to reduce or make their drug use safer or stop their drug use. And I think that's just important for people to understand that previously there's been a lot of stigma around treatment, and that has created a lot of barriers for patients to access treatment. But what we can do here at Hope's is offer a variety of treatments and help patients understand how they may or may not work for them, and kind of work with them over the long term so that they're empowered to choose the best path forward for their chronic disease. I think that recovery looks different for people, again, depending on what their specific goals are. Recovery can mean reducing the harms of their use, using it in a different way, accessing our change point services to use clean needles. It can mean working with a physician or a provider to show up and talk about other health goals, get vaccinations. Recovery can mean completely stopping use or reducing use so that they can live more fulfilling lives, based on their own personal criteria. So I think, recovery is an interesting word, but the most important piece of that is that patients are defining that for themselves and they feel empowered to tell their healthcare team what that means for them. Okay. So medications really depend on what type of substance use disorder people are dealing with. Most commonly here at Northern Nevada Hope's, we treat opiate use disorder and alcohol use disorder, because those are the substance use disorders that have the most effective medications to help patients. Specifically when you're thinking about opiate use disorders, Hope's provides buprenorphine, which is an amazing medication that decreases risk of death from overdose, but also really importantly helps patient engage in their health care. And it does that in a number of reasons, or a number of ways. It helps them show up to appointments, helps them stay out of the hospital, helps them decrease their drug use, and then actually has data to show that it decreases HIV and hepatitis C, which is really important to patients too. So that's the number one medication we really use to help patients reduce or stop their use of opiates like fentanyl, heroin, pain pills. There is also a long-acting injectable form of naltrexone, which can be a good option for some patients to reduce opiate use or, in fact, alcohol use as well. If patients are open to other treatments, there's methadone that they can have outside of Hope's. We don't provide that here at Hope's, but that's another really important way of treating opiate use disorder and helping patient engage in their healthcare and reduce their risk of death from opiates. But that one's not offered at Hope's. In terms of alcohol use disorder, the one that we most commonly use is naltrexone, which is an easy once-a-day pill that really helps reduce cravings for alcohol. Patients can be on this medication while they're drinking if they want to reduce their use or if they're struggling to reduce their use. There's many other medications too, and I think the most important thing for people to understand is that the variety is helpful, and so we can really speak to what patients care about, what they're worried about, and find the appropriate treatment for them. What I would say about treatment for substance use disorders is that there's very effective medications and behavioral health supports here at Hope's that can really help patients identify and treat their health goals and decrease their risk of use, decrease their risk of death, and help them engage in their health care.